And we are live.
Good afternoon and welcome to today's Community Conversations on Race. My name is Rocio Rodriguez and I'm the Director of Sonoma County COAD, Community Organizations Active in Disaster. And I would like to introduce today's topic around COVID-19 and the approaches from this wonderful panel right here. If we have enough time, we will take questions at the end. For now, let's go ahead and listen to our panelists. Please share a little bit about yourself, introduce yourself, and give us a bio. And we're going to go in this order. First with Dr. Baldwin, Dr. Kismet Baldwin, Ezequiel Guzmán, Dr. Jose Morales, and Dr. Brian Prystowsky. And Brian, please correct me. Okay, awesome. So let's go ahead and start with Dr. Baldwin, please.
Hi, my name is Kismet Baldwin. I'm the Deputy Health Officer at Sonoma County Public Health Services. Very quickly, born and raised in Ohio, so I'm from the Midwest. I've crisscrossed the country a few times for education and training and work, and settled in the New England area for a few years to practice neonatology, so taking care of the sick and the premature babies for some years, and then really, started to develop a desire to move into the public health arena. And so I switched my focus a few years ago and I came out to California for the second time to work in local public health. And that's, I think, the quick version of how I ended up here. And I've been in Sonoma County for a little over a year. Thanks.
My name is Ezequiel Guzmán. Our family has been in Sonoma County since 1959. I come from a family of migrant seasonal farm workers that we traveled throughout various states to work hard and put food on the table. Luckily, I was able to go to school to UC Davis, and my emphasis was workforce development. I've been a workforce development consultant working with the Department of Labor programs for over 40 years, primarily working and focusing on farm worker workforce development. And I began to volunteer 2 years ago when this COVID pandemic hit. And I've always worked and focused on farm worker advocacy. And that's my background, briefly.
Thanks, Dr. Morales.
I'm Dr. Jose Morales, and I've been in Sonoma County for almost 25 years, working at Kaiser Permanente as a pediatrician. I was born and raised in Miami, and my father's from Puerto Rico, and my mother's from the United States. And I decided to leave the sunny South Florida for California after medical school. I also have a master's in public health, and I'm very interested in both population health and individual health, especially focusing on underserved communities.
Wow. Oh my goodness. Dr. Baldwin, I didn't know you were a neonatologist. That's awesome. We have like 3 pediatric people here. I'm Brian Prystowsky, and I'm a general pediatrician. I have an interest in public health, but never actually got an MPH like Jose. I really want to do that. I feel like the more that I've been involved in public health in the midst of vaccine advocacy over the last few years here locally, I've lived in, the more that I've really realized that I'm passionate about it. I work for Sutter Pediatrics, and I teach at the Sutter Santa Rosa Family Medicine Residency Program. Once a week, I get a chance to teach residents pediatrics, which is another one of my big passions. So I like teaching, and I very much am hoping that with today's conversation that our folks who are watching will get their questions answered that they might have had, and learn something about how each of us is navigating the Delta variant and coronavirus over the last year and a half.
Yeah.
Thank you all. And just to echo what Dr. Prystowsky just mentioned, I've also just learned a lot about you all. So thank you for sharing. So each of you in your own right have led the charge locally on vaccinations, testing, and overall COVID response. Can you tell us a little bit more about the work that each of you have been doing? And we'll go why don't we go in the same order that we just went through? So we'll start off with Dr. Baldwin.
I think everyone else, I'm going to try not to spend too much time because what you're doing is more interesting, right? But so since the COVID, pandemic started, we really we scaled up. We've developed a COVID section of its own within public health that includes contact tracing. Those people who may call you and not be so excited that you may not be too excited to talk to. Because they're letting you know that you've come in contact with somebody who's got COVID. Case management, where we're reaching out to people who've been diagnosed with COVID-19. Testing, vaccination, I think that's been the big one lately, testing and vaccinations in the county. And, using epidemiological data to try to focus and target what we're doing so that we're making, getting the most bang for our buck and making the largest impact on the communities that we're seeing are most impacted by COVID and also have the lowest vaccination rates. So that's been our, the large part of the last year and a half for our COVID response. And then I think the most important part is what everyone here is going to talk about is we've been trying to collaborate and work with community partners and agencies and community members to make this a successful response and get again to the people that really need it, the resources and everything the most to get through the pandemic. So that's the overall response from public health.
Okay. I'll go ahead. First of all, I want to say that I think what was really critical up in Cloverdale is to form a real strong partnership with Alexander Valley Healthcare. They are really the small clinic, the small provider in that community. And it was essential that community come together with our local clinic. And I can't say enough about Alexander Valley Healthcare. They really stepped up. They were flexible. They were really worked strongly with the community. After the initial events of having these large events at the train station, we had communities that were not coming in. So what we decided to do was we decided to take the vaccine to the barrios, to the neighborhoods. We decided to create accessibility where essential workers, for some reason or another, because they were working in childcare for whatever reason, they were not able to access vaccines. So what we began to do is take it into the neighborhoods, take it to the apartment complexes. So, if you understand the life and culture of a farm worker and essential workers, they work hard, they're surviving day to day, and sometimes it's hard for them to get out after a hard day's work. And you just want to relax, and getting the vaccine is not at the top of your priority. So if you bring it to their communities, they've come home, they've eaten, they've taken a shower, and you're right outside their doorstep, they're going to come. That creates accessibility. So it's so critical to take the vaccine to our community. And the other thing that we did is our community, we have to understand our culture, they're very faith-based. They're very strong. A lot of them, the majority of our people are Catholics. So we involved our Catholic priest in Cloverdale. And what we did is we asked them to be part of messaging, and we asked them to come to our neighborhood vaccination events. And we said, could you please speak to those people that for religious reasons, they do not want to take the vaccine. And once Father David did that, Father David did that, lo and behold, we had like almost 100% of the people that were hesitant for religious reasons to take the vaccine. But we went even further. What we did was we asked Father David to please thank every person that was getting a vaccine and to have them to please invite their family, their friends, whoever they know is not vaccinated, to come and be vaccinated. That was a message from Father David to the community. He picked up on what we were doing, so he took it to another level, and we began to vaccinate after Mass on Sundays. So he was giving him the go-ahead on Sunday, and then go for it. It's right outside the door. Let's get vaccinated, and that's how we got such high vaccination rates in Cloverdale. It was involving the community.
Great,
So-
Dr. Morales.
when you ask that question, what have I been doing? In all honesty, I feel like not enough. What I work, I used to do a lot of administrative work and do work in different regions of Kaiser Permanente. That's the organization I work with. And now I work in the clinic and I see patients while I'm here every day. So after hours, I might do some kind of town hall meeting. I've done some with local politicians. I've done some with our local leaders within Kaiser, and I'm trying to reach different audiences any way I can. That means our physician group and our support staff group, and being that voice of reason, that voice of explaining what many experts within my own organization are already doing, and they're doing the lion's share of the work, and I'm standing on their shoulders. This little me standing on these big shoulders, saying, repeating what they're doing every day. And I'm here today doing this. I think the biggest impact that I've seen, and anybody who's seeing patients every day, is validating one person at a time, one family at a time. They'll say, Dr. Morales, what do you think? I trust you. And I'll say, do it. And then they'll do it. And so I say, I help that one family. And that's how I've been doing it every day.
Oh my goodness. This is such an awesome space to be in right now. It's so humbling. I think the question is a really tough one, because I think clearly each of us has like strengths that we've been trying to bring to the table, and kind of all hands on deck. And just to honor Jose, just to say, when you say, I feel like I've not been doing enough, I just want to being a doctor is just like really hard. And I think that it's really busy, and I feel like we're trained to do as much as we can in the systems that we're working in. And it's interesting how this pandemic has like had so many phases to it, because I feel like what Dr. Baldwin was saying right off the bat, over this last year, even before we had vaccines, so much of the impact was like public health, because contact tracing and testing, I mean, I feel like when we're not in public health, there's only so much you can do when you don't have an ability to feel like you can kind of monitor the illness and monitor and try to encourage people to wear masks. But the vaccine, I feel like, gave us this role. I think that Zeke, as he said, like the barrio resiliency, like really meeting people, just building trust this whole last year before the vaccines. But I feel like the vaccines have given us as physicians in so many ways this like permission to now say, hey, the data, let's, like you said, help validating people's hesitancy, but help translate for them how to interpret the data that has been so impressive. I think as soon as we first read it in December, and we read it fast because it kind of came at us relatively quickly. But one thing that I can kind of share from the beginning of all of this piece about like kind of locally where I felt like I had an impact was early on our community strengths. The eligibility for vaccines was for adults, and you got 3 pediatricians in a room here, and pediatricians are trained to talk about vaccines all the time in every visit. So early on, I felt like 2 kind of ways to try to help, which this is almost old news at this point, but maybe just nice to think about nostalgically. I think we have a healthcare system that is fragmented, and we'd like to be able to say that public health is always the glue, but they've been under-resourced. So we have a few big healthcare systems locally that are used to kind of doing business within their own silo, which is true of a lot of different sectors economically, but I'd say healthcare is the same. So one thing early on that I tried to do was see if we could bring everybody together. And I did this kind of I'm in campaign early on that I know, Kismet, you were in this, and Kaiser was in it too, and so was Sutter, and so was all of our CHC. I know, Rocio, when you were part of that group, we basically, like, all of us together as like a community healthcare professional said, we all believe this vaccine is the right choice. The second thing I think, so that was, I felt like, okay, let's all kind of like unify and like go forth. The second thing that as pediatricians, I tried to do was send out a communication training for my adult colleagues to try to help geriatric folks who are talking to now folks who are 75 and older about vaccines, how to navigate vaccine hesitancy. Because I think that that's a really practiced skill. And I know that as Zeke was saying, he's so good at like meeting people where they are. But when you kind of talk about vaccine hesitancy, a lot of us are like, but you should get the shot because the data shows this. And we don't always hear people. And I think that as pediatricians, we're used to listening to parents a little bit more. So early on, I thought those were kind of two things: trying to unify our community early, our health professional community, and secondly, trying to help people who aren't as used to talking about, particularly ER doctors, not as used to having these conversations slowly and trying to listen, have that extra little bit of patience and empathy for just an overwhelming disease that has really had a huge mental health impact, especially I think on our communities. And as we're all here in community conversations on race, we've all seen the data, it's disproportionately on communities of color.
Thank you.
Can I just kind of, if we're in conversation mode, just to go back to, what Brian was saying, Dr. Prystowsky was saying about, kind of feeling like you weren't in it until the vaccine part. But I have to say, public health couldn't and can't do it alone. And so we're kind of, on the shoulders of what you guys are doing as well, out in the community. If it's, doesn't have to be giving a vaccine or giving, doing contact tracing, but the conversations that, you and Mr. Guzmán are having, in the community, or just, organizing in the communications, and, Dr. Morales, his conversations with his patients or the patient's parents. So it's like, this was always, it had to be bigger than public health.
I remember, can you see this? Remember when you gave me this, Brian? I think the best part is working with colleagues that I felt inspired by. And I think all of you have really inspired me. So thank you for that.
And I think I want to echo also, public health is multifaceted. There's many layers to it. It's a whole team effort. It's not just one department or one school or one group of people. It really is. It's everybody having a hand in it, including community members too, who are affected. So I've heard a little bit about this, about trust and about reaching out to people and going to where they are. I want to hear a little bit more about how you are building trust, or how you have seen trust being built in the community. What are some consistent messaging, or we were talking before earlier about consistent messaging that was being put out and meeting people where they are. So I just want to hear a little bit more about that. And we'll go in this order, first with Zeke, Dr. Baldwin, Dr. Morales, and then Dr. Prystowsky.
Thank you, Rocio. Combating COVID-19, this pandemic, is about trust. And, and what I feel is that I want to talk about the populations that we're all very concerned about: our essential workers, our people that live in day-to-day poverty. And we need to understand the culture of the life of families who live in poverty, so we can really begin to be able to reach them. And the way I think is that, acts of people, so people live in poverty. If you can soften their blow just a little bit on the day-to-day survival and build trust with that, that's what we do. And that's what we did in Cloverdale. We built trust with acts of kindness. And Rocio, don't forget, you went to help me one day. You were behind my pickup truck unloading boxes of food at the Barrio de Tijuana in a poor trailer park. Remember? We were dropping off boxes of food. And when people begin to know you, they begin to trust you. You know, when, for example, I'll tell you one very simple thing that we did. Last year when COVID got started, and I was meeting with some families, and they were telling me, you know, Don Ezequiel, I don't know whether, when I go to the store, I have to decide whether I'm gonna buy a gallon of milk or a roll or toilet paper. You know, that's how poverty is in this county. People have to make those kind of real critical decisions. I'm going, wait a minute, what's wrong with this here? Why should people have to decide between a carton of milk and toilet paper? So I have this great friend that belongs to the Promise Center, this Christian church in Santa Rosa. And I called her with a problem. They brought up a whole U-Haul truckload of toilet paper. We started delivering that. You know, your presence at the food banks to listen and hear the people and see the people, they begin to trust you. You know, so, you know, we drop off diapers. You do those small things that make life just a little bit easier. So when you approach them about taking the vaccine, they say, you know what, I trust you. That's the first thing that we did. The other thing we did is we went into the barrios and identified people who were leaders within their own communities where they live. And it was 12 incredible farm worker and house cleaners that Dr. Robert Martinez and Brian and Dr. Allison Bacon came out to Cloverdale, and they did training with these people in the barrios about COVID, and so they could have a little bit better understanding. And they found out. And started talking to people. And I would love when Dolores Alfaro would call me and say, Zeke, I'm sending you 25. Send them over. You know, I mean, that's the kind of, so it was community taking care of community. So what I believe in the barrio resiliency model, it's called Nos Cuidamos Uno al Otro. We take care of each other. You know, and so that it's more of a spirit than an organization. It's a spirit of really wanting to take care of each other, and that's what we did. So we became trusted messengers through what, you know, be kind through acts of kindness. I mean, that works. It really does.
Thanks, Zeke. Dr. Baldwin?
So I think that we've been in the position of, we're trying to build trust and we're not there. We're just not. That's not where we're at for various reasons. And a lot of them are good reasons. It's certainly hard to build trust when your house is burning down at the same time. So we've relied heavily, and for good reason, on people like Zeke and other, you know, community leaders and, you know, trusted people in the various communities. Well, really, you know, any community, but various communities that we're really trying to focus on the most. And that's been I think our most successful and best way to get the word out and information and education, and being flexible in how we're interacting with people and providing that information. Okay, if you're telling us radio is better, then, you know, X, Y, and Z, we're going to try to do that. If you're saying we need, you know, something in multiple languages, or at least Spanish, we're going to try to do that. Now, is it always successful the first time around? No. It may not be as successful the second time around, but we're going to keep at it because we want to do the right thing and we want to build that trust. But I think we've got some work to do, but working with people who are trusted has been invaluable in the response, and getting to I think the populations that you know, rightfully so, don't necessarily trust us yet. But we're going to get there, I hope, to the point that we're going to put the work in. We plan on putting the work in to get there.
Trust building is continuous. It's always an activity. Go ahead, Dr. Morales.
Three things come to mind. And the first one is the idea that we have to first start by being trustworthy. In many ways, we're asking a group that we haven't always treated as an equal to think all of a sudden you're an equal, trust me. when we haven't necessarily always treated that population that way. And if you called it a bank account or a trust bank account, is pretty empty. So what I did learn this year is the idea that I didn't really learn the value of my trustworthiness until this year when it was called upon. And it wasn't in a big community setting, because if I speak with Brian, he's the guy who's known. I'm there saying some things, but he's the workhorse. I'm just showing up one time. But in my practice, I remember we were at the JC when we were talking, and a former patient of mine comes up, and he's this huge football player, and I hardly recognize him because I remember him as a little kid. He's like, "Dr. Morales, you are my doctor. I trust you." I did a community town hall meeting that went live with Senator McGuire, and a patient today said, you said 3 words at the very end that touched me, and we got vaccinated because it was you. And those kind of things, I like I said earlier, somebody says, "You're my doctor, you've been there always. What do you think? I trust you." And that impact really hit me. And then finally, there's going to be a next time for something. What mistakes can we learn from? Where have we fallen short? I mean, where could we learn to do better for our community for next time, so that we do build up that trust bank account and really are there in a way that we can provide things and people will believe it. So that's what I think about trust.
Oh man, Jose, that's so useful. I'm taking notes if you guys are wondering. I always feel like I'm learning whenever I'm around people who are as incredible as you guys. I think one of the things that, Rocio, like you said, in some ways that trust building is kind of a continuous process. And in medicine, like one of the things that we have with continuity is we often leverage that. So when Jose doesn't have to say anything, he can just sort of show his face somewhere and people are willing to listen because he's earned it, just like Zeke. Just to kind of say something about that guy, when Dr. Burdick was the medical director up at Alexander Valley earlier in the pandemic when we had vaccines, Zeke would just show up at the vaccine sites where it was drive up, and most of the people administering vaccines were traveling nurses. So they were kind of new to the area. And actually, a lot of them may not have even spoken Spanish per se. And Shelley Burdick, the medical director up there, said Zeke would just walk around from car to car in the line. And just by being there, sort of what Jose's saying, just by being there as somebody who's earned that trust in other settings, this is sort of the concept of, like, in many ways, as I think Dr. Baldwin is talking about, the promotores and the community-based organizations that are like visible and have, like you said, Jose, it's like they've been trustworthy on many levels and other facets with the kindness that Zeke was kind of mentioning. I feel like it's just this whole pandemic has really like been a all hands on deck like mentality from the beginning. And I think that when you look at Kaiser Family Foundation data, and because another thing I didn't mention in the bio part is that I've been very involved in This Is Our Shot, which is a hashtag social media campaign, and their Spanish counterpart is called Vacunate Ya. And this campaign has it's health professionals from all over the country who are trying to work to help each other, and with like providing accurate messaging in terms of particularly on social media, which is where a lot of younger folks get information. But the reason I'm bringing it up is that the Kaiser Family Foundation survey data is often a lot of the data that we have to talk in public health and in our kind of offices about how do we kind of empower the people who have community trust. And rarely does the data say It's like, it'll say like faith leader, like Padre David, like you said, or it'll say physician, or it'll say, community outreach worker. But rarely does it say, well, what if you put an artist with an outreach worker, with a public health deputy, with a community pediatrician, and a person who's running COAD in the same room? How trustworthy is that crew when they're all saying, we all think you should get vaccinated? It's just like different when it's like community taking care of community, as Zeke's barrio resiliency model says. It's like, nos cuidamos al otro, like we take care of each other because we all actually are more than our occupations. I feel like if there's a way that you can kind of communicate that to the other person that you're talking to, whoever you are, whatever credentials you have, because I know a lot of people are like afraid to be a spokesperson because they're like, I'm not a doctor, or I'm not whatever that needs to be to give you that permission. But as Zeke was saying, once you are somebody who's been vaccinated, your story matters right now. So if you could say why you decided to get vaccinated, we all need each other in Sonoma County. And I think that when you talk about, with fires, as you mentioned, Dr. Baldwin, we had this sort of Sonoma strong mentality where you could like look at your neighbor and be like, I know purple air is not good right now. We were all saying the same thing to each other. And it's kind of like that right now. It's like, I know we all need to get vaccinated right now.
Thank you. So I'm sorry, we just had a question come in from our Facebook chat. So for those who are watching and you're not aware, you can also ask questions through Facebook Live. If you go to, I believe, and Katie, correct me if I'm wrong, but if you go to CAP Sonoma, Community Action Partnership Sonoma's Facebook page, and it'll pop up, and you can also go look at the comments. A question that came in was if there are vaccine rates from the cities that are available. And Dr. Baldwin, I kind of want to give you that question. And if you can answer that live. I also see that somebody just posted a link of the data, but I'll give you a chance to look at that while I ask this next question, and then we'll transition to that one. So Dr. Morales, you actually touched on this very briefly, and I just want to give you a chance to maybe expand on it, and then the other panelists as well. We talked a little bit about how systemic racism plays a role in creating a lack of trust in our system. Can you talk a little bit more about that?
I'm no expert in that. I can just give you my own personal thoughts. I think, and again, this is just me personally. I'm excited about getting local activists and local people coming together, and a lot of this is volunteering to try to help create trust. But at the same time, I see this as patchwork for a larger issue where I kind of wish that the system was trustworthy to start with. And it's no one person or no one policy. I think it's a combination of things where sometimes we forget, or we have unconscious bias, or we have past history or past beliefs where sometimes someone may be left out. Someone may be, we may assume something about what a person is thinking or doing or what their needs are without really asking. And when we do that as a government organization, as a policy in the state, or whatever it is, it falls on deaf ears. It doesn't sound right. And I think those are the little things that can end up breaking trust, because how can you believe in a system that doesn't understand you, or doesn't try to understand you, or already makes assumptions about who you are without even really getting to know you? And so I think there's been so much work on solving those problems that it's impressive to see how much has happened on the other side of the coin of what we've seen these last 5 or 6 years. There's the good too. There's still more work to be done. So that's what I'm getting at, is that we need to really step back and learn where our mistakes have been so we don't make them twice.
Great, thanks. And Dr. Baldwin, we had actually talked about this during our prep meeting, and you had actually mentioned this. So this is why we wanted to include the question in here. Would you love to
Yeah. I mean, Dr. Morales is, said a lot of what's on my mind, but at the, in our conversation previously, the reality of years, and it could have been yesterday though. I mean, the years of institutional and systemic racism from health systems or the government or just in general in the United States really has eroded the trust that the populations we really need to get to have in us. And if you keep eroding, it's, and you get to the point where you're in a pandemic, it's really hard to convince someone that they should trust us. And I think that's what, Dr. Morales was getting at, the bank account's empty right now. We don't have any credit. And so it makes it difficult. And it's understandable that people either don't trust or hesitate in getting what's being offered, because you've been offered something in the past, or you haven't been offered when you should have been offered something in the past. And it's really, it's a tough position in a, I think, a vicious cycle, frankly, because you don't take what's offered because you don't trust, which is totally valid. But then you've put yourself at risk of, getting COVID or getting an illness or ending up in the hospital or dying or, and so then it's the same populations that are the most affected and impacted over and over again, because it's that same cycle of, distrust and making understandable decisions that end up only hurting that same group over and over again. And I think getting to the point where we can come out of that cycle is going to be difficult, and it's worth putting the time in. And again, it all goes back to trust and putting the work and the time in to get to that point, because it makes me very sad to see when minority or vulnerable populations are the ones that are faring worse. And even well-meaning people say it was offered to you and you didn't take it. And now you're not doing as good as other populations, and not really, putting the thought into why those, populations or people may not have accepted the assistance that's being offered. And so it's again, a vicious cycle that I'm hoping that we can get it out of eventually. And it's not an overnight thing. I mean, it's just not. You can't, again, erode trust for years or sometimes hundreds of years and things like that, and then expect that it's going to be okay the next day because we're saying trust us. And these are large institutions, and the founding of a lot of the structure of our society. So the expectation that that's going to change rapidly, I think, is a little unrealistic, but we have to keep going at it. I think we'll get there eventually. It's made it very difficult for the pandemic.
I really agree. And having these conversations is sometimes the first step, in listening instead of assuming.
I agree.
Yeah, I
I'd just
agree.
like to go ahead, Brian.
No, you go ahead first, Zeke.
I just like to talk about just one of the subjects under institutionalized racism, which is economic racism. We all know that there was a study done a couple of years ago where in order to live a livable life, a sustainable life in Sonoma County, people have to earn $24 an hour. Our essential workers in the vineyards, the hospitality industry, the food industry, they make anywhere between $13 to $19 per hour. They go into poverty and further into poverty every day, not just part of the year. Okay. And that is what makes all the other institutionalized racism come into play, because our people are struggling, you know, and we need to look at that, because what I say is that here's the way I see it. Our essential workers are the atlas. Have you guys ever remember that guy that held the earth, an atlas, Mr. Strongman or something like that, and he held the earth up? Well, our farm workers, our essential workers, our people that work in the hospitality industry, they're the atlas of Sonoma County. They're the strength that sustains our economy. And they can't put food on the table. We look at the food lines at Redwood Empire Food Bank, and they continue to grow every week. You know, you look at people that are looking for emergency food on a weekly basis, even after the Redwood Empire Food Bank went through, and we begin to see this increase. So the economic disparity is a form of racism. No, it is racism, sorry. Okay, so that's the way I see things. And as long as it continues to happen, I don't know what we're gonna get out of this. You know, that's my idea, my feelings.
I feel like one of the I agree with Jose, what you were saying about like conversations like this, but just saying something and like giving like space to people to validate. I think like this is, if you think about this, this is Dr. Baldwin works for our public health department and is straight up saying that our public health department in many ways, in the not necessarily right now, I think people are really trying hard to, as you said, kind of learn from like mistakes that we've made in the past. The health industry too, I think unconscious bias, but I think a lot of healthcare workers are pretty impatient. And, you know, when here's one thing that's tough too, is that like we tend to interrupt people in like 15 seconds. That's what like the data shows. How do you really like listen to somebody honestly when you're gonna not even let them talk about why they're even there to see you about their health issue, let alone to even begin to explain why it is that they may not want to get vaccinated, and how many layers of that onion there are to kind of peel before you really can start making an impact. And I think continuity helps, like we kind of were saying in the health industry. But I feel like another level to this that's also tough, that since the beginning of this pandemic, or sorry, yes, but particularly I feel like my like more active role, I feel like since the vaccines came to town, we started meeting in this public health meeting with the Committee for Healthcare Improvement with several leaders from community-based organizations. And so much of the discussions have been like leaning on people of color. And, you know, I think one of the reasons why we're actually, all of us are here, just to, I mean, we are people of color. Just to like say that, like, this is a hard conversation for white people to have. And I'm actually, I mean, I know Jose and I are both mixed race. I have a white dad and a Filipino mom, which is another tough location to think about. Where do you fit? Because like, I think one of the reasons that, let me make my first point first and then the second one. The first point though is just to say that when we sort of say the promotores and the Ezequiel Guzmans and the like people in the community that have the trust of the community have that like responsibility to like be the communicators for us, that are like the trustworthy communicators, when we've like not actively like used, like kind of empowered them, maybe you should say, like in other manners, as you said, Jose, like of like how do you in a system that has sort of used people and not supported them, but use them because it's saying like, hey, you have the trust of the community, you be our salesman to them. It just feels bad, and it feels bad over and over again. And I feel like I want the systems to be better. I want healthcare to be better. I want us to have universal healthcare. Just gonna say that. I feel like we shouldn't have healthcare based on where you work. Doesn't feel like a human right. But I think in many ways, like to also say, okay, Dr. Baldwin, you're the person of who's Black African American in this room. Jose Morales, you're the person who is Latinx along with Zeke. And Brian, you're the AAPI member. It's a lot of weight to carry when you're the person in the room who's the person of color. And people will be like, well, you know, Brian, what do you think we should do to talk to AAPI community people? And, you know, Jose and I, we're like seeing patients every day. It's hard to be that like in that Asian diaspora to be able to say what all AAPI people need in order to trust big health industries. It's just an impossible. That's where I think you might say, like in some ways, Zeke's approach or Jose's approach, you know, or in fact, Dr. Baldwin, I feel like you have that same personable character, like each individual conversation, it actually becomes more human to human if you can let it be that. When I coach people about having vaccine hesitancy conversations, for those of you watching, when you're talking to your friends who might be people of color and you might be white, it's okay to say, hey, what are you thinking about with regard to like this vaccine? Is there anything that you're worried about? And give people space, and don't correct people. Don't say, like Dr. Baldwin was saying, like, hey, it's, you know, it seems like the people of color are disproportionately the lower people in terms of uptick with vaccine acceptance. That's not like a very healthy statistic to bring into a conversation. You got to kind of hear people where they are and be patient. And it may not, you may not be the person to fix the situation, but you may be the first person to ask.
And Dr. Prystowsky, Dr. Morales, go ahead.
I just wanted to say one thing is that for this particular conversation, when it comes to vaccines, and Dr. Baldwin, you gave me this data. It's not like I had it in the top of my head, but it's 76% of the eligible people in Sonoma County are vaccinated. If we could get 10% more, and it seems like in some ways that 10% is the group that Zeke works with. You've got that 9,000 plus workers who are, you know, the Atlas, the workers in this county. You know, we need to, for the future, for right now, we need to listen. How do we make the system work for them in the long run, so that we have, it's not just getting vaccines, it's getting if our population is educated, then they're going to bring education and knowledge into this community. If our kids have preschool, then they're going to have a better chance of graduating high school. If there's access to physicians and health, then they're going to be working more. They're not going to be taking time off or are getting other disability issues, issues of psychology, where, you know, there's not going to be depression and drug abuse. I mean, on and on and on. And it seems like there's two hands clapping to a very large that are not clapping, or they're missing, to a large group that we're ignoring. And that's where I think sometimes the unconscious bias comes in, is that we don't even see them. And so I would love to see somehow we as a county come together and think about the 5-year, 10-year, 20-year plan of how we're just going to make it better.
I love that idea, like planning ahead, actually planning ahead, and not, you know, trying to, you know, put out, again, I have to stop using the fires analogy in Sonoma County. I'm fairly new to Sonoma County. And with the situation here, it's probably not the best analogy, but, you know, having to deal with emergencies at the moment and being more responsive than proactive. It would really be great if we can get out, you know, start the proactive side of things. That's what I like about public health. Let's talk about prevention and being proactive, so we're, you know, hopefully preventing something down the road, even if it's 20 years down the road or something like that. But really, really like that idea and that thought process. And you know, I think it's a little bit of it gets used commonly. It takes a village, but I really do think it takes a countywide effort. I mean, it really does. It can't be public health, and it can't be the health system, and it can't be, I think that even the on the ground and the grassroots community members and organizations it should have support from the larger community, and it shouldn't have to just be shouldered by them to make change in the county and the community. And let me just be very clear before I don't have a job tomorrow. I'm not saying that Sonoma County is, generally people working for Sonoma County are racist or anything like that, but there is unconscious bias. Everyone has it, and there's a well-documented history of institutional and systemic racism throughout the country and the state, and every county has some history of that. So it's not just a Sonoma County thing, and I'm not saying that
no
it's
way
intentional in any way. But
actually, Kismet, I learned in some of these community conversations on race discussions as part of the AAPI history. I didn't even realize that the our like fairgrounds used to be like an internment camp, like for like Japanese internment camp. Like I feel like there's a lot of history, and that the Chinese population had built the vineyards. I mean, there's just all this, there's so many levels to like the histories that are invisible, as I think Jose is saying, that sometimes we have to like acknowledge and listen and hear what people are thinking when I don't think that you should be fired. Please, I think like in many ways, like the fact you should be almost celebrated for being here. I mean, that's like one of the hardest things to do, is to like have hard conversations when they need to be had. And I just want to say one thing, Jose, that you may not be aware of, and Kismet, you too, about this concept of where Sonoma County is, at least with this this community, the Committee for Healthcare Improvement that I've been meeting with those leaders. There's these groups like Latino service providers and the Community Outreach Collaborative, where Dr. Jenny Fish and Griselda Correa have been working so hard. I know, Rocio, you know all them as well, to try to, with Isabel Lopez and other just sort of like community leaders, along with it's a way to kind of in some ways create a community health worker workforce, and they're working on it now. And it's sort of like in this meeting where like you have a foundation person like Kim from Kim Bender from Healthcare Foundation Healdsburg in the same room as some of the community-based organization leadership, in the same room as health professionals and public health people. I just wanted to say that there are people that are trying to work like together to create some sort of this workforce, so that it's not just about the vaccine, Jose, it's about like just the greater health and investment in people in our community. I'm leaving out the Center for Wellbeing is another one of those big kind of players that's working together, just to kind of say that with Carissa Moreno.
And Dr. Prystowsky, oh, thank you. Thank you so much for that. I think that's a really valuable shout out to a lot of other communities and organizations that are doing, and individuals that are doing a lot of work. So thank you for that. I am going to pivot and really want to bring up to talk about vaccinating children. And this is specifically for Dr. Morales and Dr. Prystowsky to talk about your perspectives. What are myths that you might have come across? You're both pediatricians. What are your educated opinions or your research? What can you share and advise on the subject to parents? Maybe even share a little bit about some of the recent news that came out. I'll give the both of you a chance to respond to that.
I'll start it because I'll be the shortest. But also those things that I'm saying about 5-year, 10-year plan, I'm sure there's very smart people who are thinking that already. I'm just talking. There will be a vaccine, and it's going to be 5 to 11, which means that 5 and up, 5 to 110 will be available for vaccines pretty soon. from what I hear, it will be Pfizer, and it will be sometime in late September, early October when that approval process will finalize. That's all I know. And I'm 100% supportive of it. And I'll let the rest of the team talk about it.
Yeah, I agree 100%. I think you may have heard all of us in this room really believe in these vaccines. We have to see the data. I think that all of us are scientists in that, I think parents particularly want to know that the vaccines show that they're even at particularly one of the things they're working on is using a lower dose to be able to get the same efficacy but decrease side effects that I think are unwanted, that a lot of adults have used as a reason to maybe be concerned about getting vaccinated. But one of the ways to think about your kids, if you're watching this and you're a parent, is this reality that we in Sonoma County are, as I think Dr. Morales and Dr. Baldwin were saying, we are so far ahead of a lot of the country, and you might even say the world, with regard to community vaccination rates. Because right now, if you really say like in our community, we have like 76% of eligible people are vaccinated, there's not a lot of places right now that can say that. And what that means is that coronavirus is not going away anytime soon. So the question for parents when you're thinking about vaccinating your kids is, how do you sort of live with coronavirus as a reality? Because other areas of the country are going to continue to have lower vaccination rates. Internationally, people don't even have access to vaccines. And so as a parent to parent, when I'm talking to people in my office, but also in conversations with anybody, pretty much, I ask them the question of like, how prepared are you for your kids getting COVID? And we'll do everything we can to not have them get COVID, meaning wearing masks, hand hygiene, physical distancing, getting as many adults around them as vaccinated as possible. But what's going to really help your kid be as safe as possible, and assuming that the data is consistent with what we're expecting, getting vaccinated is the best way that you can ensure that that child has some protection against coronavirus at the point of exposure. And I just feel like for my own kids, I can't wait for them to get vaccinated. They're 7 and 4 years old, assuming that the data holds as we're expecting, because just like a flu shot or all the other vaccines that we have, I just want them to be ready if and when they're unexpectedly exposed to COVID. And vaccines work, and they will keep you safe from having severe outcomes from coronavirus. So I'm sure that Zeke and Dr. Baldwin, you probably want to also say something about this too.
I was just going to say, I mean, I second everything that you and Jose have already said. I think I don't know, I've said this multiple times. I don't know if people actually believe me, but I feel like, when I was practicing, a clinician, a physician, a scientist, we're always going into something with a healthy dose of skepticism. And, I get a lot of feedback that we just follow whatever somebody says, and we don't, we're just promoting something that we don't really, know the data, or we don't really believe. I don't know. It doesn't really, support what we're saying, but I know I go into everything with some skepticism, and most physicians and scientists do. That's like the basis of having a healthy dose of skepticism and really looking at the information and the data that's presented, because we realize that it can affect someone's health, their well-being, their lives. I mean, so we don't want to promote something that we don't think has some, real teeth to it, some real data, some real, information to back it up. And I can say, there's a lot of healthy conversations that go on as well about, back and forth about data, not necessarily about the vaccines, but in science in general. Because not everyone's going to interpret what's being put out there the same. And I think that's really a positive point. And I just really want to get that across, that we don't just always follow. We do try to analyze and really think about what's being presented to us and whether or not it's they've backed up what they're claiming.
Thank you. Thank you, Dr. Baldwin. And I apologize. I know that you all have such wonderful things to say. We're coming to the end of our time. An hour has passed by so quickly. I would like to just hear briefly for the final question. What further support do you need to educate your population, your community about COVID vaccines? Financial, medical expertise, manpower, mental health support. What are some of the things that you want to see? And we'll go actually,
because I'm going to be quick. All of the above. I think you need mental health support. I think you need funding. I think you need resources. I think you need manpower. I think you need, great people that you can collaborate with in the community. I mean, I think you need it. You need it all. I think we can't just hit it from one direction. We're going to have to, hit this in multiple directions and ways to really make a dent. And so that would be my answer. All of those, all the above at, some level.
Yeah.
I'll
just
just
like we
add,
approach everything.
I'll just add working on the concept of herd immunity, because we might have a percentage of 76%, but I'm sure there's pockets that are 40%, pockets that are 80%, and it's the average. And we need herd immunity where everybody is vaccinated at a point where we're protecting each other. The megaphone that you're providing through this talk right now is what we need to get the word out. I can talk one-on-one, but I can't reach the population that needs to hear it unless you guys give us this voice.
Okay, Dr. Prystowsky.
I think I hope I'm not stealing Zeke's tagline here, but as I'm kind of hearing all this, I feel like we need each other, because I don't feel like, I feel like without that, I don't think we're going to make it through this. So I think that the more that we can lean on each other in whatever capacity that is, professionally, personally, when you are looking at the person that you love that's in your house tonight after you watch this, how do we protect each other? I know I stole your tagline, Zeke.
Not to worry.
Go ahead.
I'm glad you did it. All I'd like to quickly say is we need to involve the community at their level. We have to, because you know what? They truly do understand. Once you take some time to listen and explain what's going on and have a better understanding, they will get involved and they will help to protect themselves. We'll take care of each other. That's what we need. And I think we need it through messenger hesitancy teams is what we need.
Great, thank you. Thank you all so much. I think those were wonderful words for those who are watching to walk away with. Thank you all panelists for being here. Thank you to the audience for watching and being participants in this. I'm going to say good night, but I would also like to remind you all that Community Conversations on Race will be on KSRO on September 30th from 12 to 12:30 with Shiva Person Whitley, Executive Director at Sonoma County Economic Development Board. Keep an eye out for any ads related to that. And thank you.
Bye, everyone. Congrats on your wedding, Rocio.
The whole room knows now. Thank you.
Thank you.
Bye-bye.
Thank you, Rocio.
Thank you.